My name is Miriam, and I was diagnosed with diabetes during pregnancy, and it was very hard to control my sugar, especially during pregnancy, because once they told me that I couldn't eat something, that's what I wanted to eat the most. After I had my daughter, they told me that I needed to take care of myself and be very careful because I could get diabetes anytime after pregnancy, and I didn't listen. I didn't watch what I ate. I stopped exercising, and a few months back, I went to my doctor, and she ran some tests because she thought that I might have diabetes, and my A1C count came back high. So she told me she wanted me to start watching it, um, and I did, and I went back to the doctor's appointment. She did more tests on me, and she determined that I did not have diabetes, but if I didn't take care of myself, that I would develop it pretty soon. So I started exercising. I started eating better, and so far in less than 2 months, I've lost 10 pounds, and it feels great. It was very scary because if anything happens to me, nobody would be able to take care of my daughter. And in order for me to take care of her, I have to take care of myself. And it's not a fun disease to have. And since I'm aware of what it's like, I have to be very careful and just continue taking care of myself, exercising, eating better, and just being healthy.
How's diabetes damage the eye? The eye is affected in several ways from diabetes, but usually it's the thing that we worry the most about would be diabetic retinopathy, changes inside the eye where the blood vessels will bleed and we'll see hemorrhaging, and it can eventually, if left untreated, lead to blindness. Diabetes is the leading cause of blindness in adults, so it's something we watch very closely and we monitor, and we want everybody who has diabetes to have their eyes checked at least once a year. If we notice problems in the eye, we would want to see them sooner, more often, and maybe every 6 months or whatever, depending on how bad their particular problem was. You had asked about the Latino population and diabetes. I see a high percentage of our patients, regardless of race, have problems with diabetes. It's certainly not just in one race, but some of the worst cases possibly may be in our patients that are Hispanic or Latino, and that may be because they don't get the treatment that they should otherwise.
Dr. Davis with Brown Eye Care. The first question I had was, diabetes cause early glaucoma and cataracts? And the answer is absolutely yes. We know that diabetes is a vascular problem, which can lead to glaucoma, but also the increased blood sugar throughout the body can lead to early development of cataracts. The other question that was posed to me is, does the Latino community do a good job about treating and taking care of their diabetes and eye conditions related to diabetes? And unfortunately, the answer is not yet. We still see that the Latino community could do a lot better job about having regular visits and taking their medications more consistently. I think as we get more education out there, we will see a increased improvement in how the Latino community treats their diabetes.